So today's topic is splenomegaly. In this, we'll be covering the causes of enlarged spleen. So splenomegaly is defined by increased splenic dimensions and volume. Spleen diameters averaged over 13 centimeter and an area above 45 centimeter square or weight above 400 grams are considered splenomegaly. So it is a large, highly vascular lymphoid organ. It is the largest of the ductless glands and is soft and dark purplish in color. It's a wedge shaped and located in the left hypochondrium, partly in the epigastrium. It forms a wedge between the gastric fundus and the diaphragm and lies beneath the 9th to 12th ribs. The hilum sits in the angle between stomach and the kidney and is in contact with the tail of the pancreas. So the axis of the spleen lies obliquely along the axis of the 10th rib. It is directed towards downwards, forwards and laterally. External features are the two ends. It has two ends, three borders and two surfaces. So what are its peritoneal relations? It is surrounded by peritoneum and suspended by following ligaments, and the ligaments are gastrosplenic ligament, that is the short gastric vessels, lymphatics and sympathetic nerves, linorenal ligament, which covers the tail of the pancreas, splenic vessels, pancreatico-splenic lymph nodes. Then there is phrenico ligament, it gives support. And then there are visceral relations, visceral and diaphragmatic surface, costodiaphragmatic recess of pleura, lung and 8th, 9th, 10th of the left rib. It is supplied by a splenic artery, which is the largest branch of the celiac artery. And the venous supply is given by the splenic vein, which joins the superior mesenteric vein to form the portal vein. The lymph vessels emerge from the hilum and drain into the celiac nodes, and the nerve supply is by sympathetic fibers that are derived from the celiac plexus and are vasomotor in nature. Now what are the functions of the spleen? Spleen has multiple functions. Firstly, the immune function. The spleen processes foreign antigen and make an bacteria, fungi more susceptible to phagocytosis. This is its immunic function. Then the filter function, it acts as a filter for the macrophages when they capture cellular and non-cellular material from the blood and plasma, including bacteria, especially pneumococci. Then there is culling, that is removal of platelets and red cells. Then pitting, that is removing the inclusions from red cells and returning the repaired red cells to the circulation. Next, pooling, that is up to 30 to 40% of blood platelets are sequestered within the spleen. Then there is iron reutilization, which means removal of iron from indigested, degraded hemoglobin during red cell culling and return the iron into the plasma. Now, what is the classification of splenomegaly? It is classified as mild, moderate and massive splenomegaly. Mild splenomegaly, it is just palpable, 1 to 3 centimeter more than the normal spleen, that is between the 14 to 16 centimeter, and it weighs more than 400 grams but less than 1000 grams. This is mild splenomegaly. Then there is moderate. When the spleen enlarges and reaches between costal margin and umbilicus, it is moderate splenomegaly. It is 4 to 8 centimeter more than the normal spleen, that is 17 centimeter to 21 centimeter. And spleen is more than 400 grams but less than 1000, and splenic area is 45 to 65 centimeters square. Now the massive splenomegaly, the spleen reaches beyond the umbilicus on palpation, that is it crosses midline into pelvis. Spleen is more than 8 centimeter than normal and weighs more than 1000 grams, and the splenic area is more than 65 centimeters square. Now the grading is done. Grade 0 is normal impalpable spleen. Grade 1 is spleen palpable only on deep inspection. Grade 2, spleen palpable on mid-clavicular line, halfway between umbilicus and costal margin. Then there is grade 3, the spleen expands towards the umbilicus. Then grade 4, the spleen goes past the umbilicus, that is massive splenomegaly. And grade 5, the spleen expands towards the symphysis pubis. Now, signs and symptoms. The symptom patient presents with abdominal pain, chest pain, and back pain. And the signs include palpable left upper quadrant abdominal mass. Now, what are the causes of splenomegaly? Splenomegaly can be due to infectious causes, may be due to increased cellular proliferation, then congestion, cellular infiltration, or infarction, or due to any injury. In infection can be bacterial, viral, or protozoal. Then in cellular proliferation, it can be due to malignancies. Then in anemia like spherocytosis, hemolytic anemia, or pernicious or myelofibrosis. Then congestion can be due to portal hypertension, hepatic vein obstruction, or congestive heart failure. Now the collagen disease includes Felty syndrome or Still syndrome. These all causes splenomegaly. Then Felty syndrome, it is characterized by rheumatoid arthritis, splenomegaly, and neutropenia. Now infarction and injury, it can be due to any embolism from bacterial endocarditis and MI, then splenic artery or vein thrombosis, or when there is any hematoma, it can cause to infarction of the spleen or the injury of the spleen. Now this is the pathogenesis and the clinical findings of the etiology I have just discussed. In case of any congestive disease like the liver or the hypercoagulable state, it will lead to portal hypertension. After portal hypertension, there will be increased hepatic portal venous pressure, which will cause the engorgement and the congestion of the red pulp. And when there is engorgement and congestion, it will cause splenomegaly. Then the hemolytic anemia or the inflammatory causes. Hemolytic anemia, the examples are sickle cell, thalassemia, or spherocytosis. They will cause phagocytosis of abnormal cells, which will lead to increase in macrophage activity, increase in blood pooling, and extramedullary hematopoiesis, which will also lead to splenomegaly. In case of inflammatory causes and the infectious causes, they both will cause the chronic inflammation. Then it will lead to increase in the activity of the immune system. There is reactive increase of white pulp, and when there is increase in the white pulp, it will cause splenomegaly. Now the infiltrative causes. Infiltrative are the benign or the malignant, that is leukemias and lymphomas. They will cause in proliferative cellular infiltration, increased blood pooling, metastatic infiltration, which will all lead to splenomegaly. And this, when there is splenomegaly, patient will complain of pain in the left upper quadrant, and there will be abdominal fullness, and which will lead to the early satiety. Now signs and symptoms. There is a decrease in the RBCs is a symptom of anemia. Then when there is decrease in WBC, it is a symptom of leukopenia or recurrent infection. Decrease in platelet status, thrombocytopenia, it is a symptom of thrombocytopenia. Now to sum it all, as I've already said, healthy spleen is 12 centimeter. More than 12 centimeter and more than 400 grams is enlarged spleen. And massive splenomegaly is said when the spleen is more than 20 centimeters and weighs more than 1 kg. We'll call it massive splenomegaly. So what are the common causes? Most common ones are the infections, cancers, or the portal hypertension. Then less common ones include hemolytic anemias like the sickle cell disease and chronic inflammatory diseases. And then rare ones are the metabolic causes like the Gaucher's disease. Now symptoms are abdominal discomfort, decreased appetite, and symptoms of cytopenias. In case of any underlying diseases like infection, there will be fever and chill. And in case of cancer, there will be weight loss and night sweats. So treatment focuses on the underlying cause, that is avoid the source of abdominal injury and prevent ruptured spleen. or splenectomy, and then vaccination to reduce inflammation or the infection risk. Now this is a picture of CVC spleen, that is the congestive spleen. It shows the capsulated homogeneous soft dark red mass, that is the red pulp, with grey white nodules, that is the white pulp. Under the microscope, it will be seen like this, with the capsule extended to form trabeculae. Then the red pulp consists of network of thin-walled venous sinuses which contain RBCs, WBCs and macrophages, and the blood spaces are arranged in cords called cords of Billroth. Then the white pulp, it consists of lymphoid follicle with eccentrically placed arteriole. Now this picture, this is a diagrammatic picture of this shows the thickened capsule and the gamma Gandhi bodies as seen in the CVC spleen. You must have seen in your practical classes also. The slides of CVC spleen were shown, right? And these are the lymphoid follicles, collection of lymphoid cells in the background.